The following is meant for entertainment and educational purposes. It is not meant to establish a doctor-patient relationship. Please consult your mental health provider for your mental health needs. Hello, welcome to Chez Eric, where we talk about psychiatry and religion with a focus on how to apply it to your life. Today we are going through William James's The Varieties of Religious Experience, and we're going to be talking about lectures 16 and 17, talking about mysticism. And I am Dr. Eric. I'm a psychiatrist, happens to be religious. If this is the first time you're seeing me, hello, but it's unlikely because this is a long series and you probably went straight to the first part immediately. So that is what it is. The next step after William James described the four criteria, the four marks of mysticism, is that he has pointed out that the mystical states, being in the mystical state, has been seen as pathological for quite some time. So he's referring to situations where people are high or they're intoxicated, right? Drugs can stimulate the mystical experience. James himself has taken nitric oxide and it stimulated the mystical consciousness in him. This sort of like, I'm not able to describe it. It feels really cool. It's, again, sounds like someone being high on mushrooms or something. However, James points out that in these circumstances, whether it's pathological or drug-induced, the truth that is revealed seems true at the time, but it eventually fades away and ends up being pretty much nonsense, right? And William James, he said, he tried nitrous oxide and he reported it, and he found that in a normal waking consciousness as well, he observed that we have normal waking consciousness and we have a something else. And this special type of consciousness, right, it sort of exists. And we go through life, we can go through life never suspecting that this special type of consciousness exists. But we do at the very least understand them because they're very different from ordinary consciousness. So there seems to be this two types of consciousness, our waking consciousness and something else, something more. And to tackle this question of what is this something more, to understand more about the mystical experience, he cites Vedantists. I think he's trying to go through examples of Hinduism. I think that's what it is. And then he would say that, they would say that you can be super conscious sporadically, but without discipline, it would be impure. And therefore, according to them, he points out that the test for purity is empirical. You test to see whether or not it's good for you or it helps you. And the Buddhists and the Hindus, they say they have a concept called dhyana. And please forgive me if I'm wrong about this. I didn't research these things. I researched only what he's telling me about these things. And it's that there's a higher state of contemplation in this state of dhyana, D-H-Y-A-N-A. And there are four stages. The first stage is where there's concentration of the mind upon one point and excludes desire, but not discernment or judgment. It's still intellectual. And then the second state is that the intellectual functions begin to drop off and there's this satisfied sense of unity of remains. You become one with this higher being. The third stage is that the satisfaction then goes away and there begins to be an indifference, but along with memory of your self-consciousness. You just don't really care anymore. And finally, the indifference, the memory, and the self-consciousness are perfected. And so higher stages of contemplation are mentioned, right? A region where there exists nothing. And the meditator says there's neither ideas nor absence of ideas. It seems like it's not nirvana, but something close to it. And so this is what he kind of described as this super conscious state of what we're trying to investigate as the mystical state. Okay. Notice how challenging it is to communicate the core qualities of mysticism. Mystical truth exists for the individual that experiences it, but it's not really there for other people to do anything about it. It resembles knowledge given to us through sensations, but it really is just a conceptual thought. And when we view thoughts and sensations, we view thoughts and sensations differently, and they're not treated the same way, but the mystic seems to lean more towards that this mystical experience is more of a sensation than it is an actual thought. Often we find that the mystical experience, that God's knowledge, can't be merely stated or communicated, but rather it's intuitive. It's not something that you're told, it's something that you understand through an intuition, through a sensation. And it's really about the feeling of it that's really critical to the mystical experience. But when it comes to the feelings, we only have 5 senses. We have our taste, touch, sight, smell, and sound. But the mystics, when they talk about this as a feeling, it's not really touching upon these 5 senses. It's something different. And it is this feeling that you are very, very well connected. But what are your thoughts? Have you had an experience like this? Does this resonate with you? Does this fit with your experiences if you've had a mystical experience, or with your prayers? Let me know in the comments below. If you like this, like and subscribe. Something notification bell. I'll talk to you next time. Bye. Hey, sign up for my weekly newsletter. I send out emails every week on psychiatry and religion. I realize that email is a great way to go deep into these topics. So if you want more content, check out chesericpurl.com and subscribe over there. Thanks.